Hello everyone, welcome back to this video. So in this video we'll be learning normal newborn findings one by one. Total approximately there are 15 or 16 normal newborn findings where mothers are confused, right? So whether it is normal or not normal, we will let's see, right? The first one is erythema toxicum neonatrum. So it is very common and harmless normal newborn rash seen in healthy term babies specifically. So the rash are red patches with small yellow white bumps like pustules, and they appear like a flea bitten appearance. So usually appear after 20 to 48 hours after birth, rare after birth. Is seen in face, trunks and limbs. Palms and soles are usually spared, right? So it is basically due to immature skin reaction, not the infection. So no treatment is needed and usually resolves within 5 to 7 days, right? So these are the characteristic findings. Erythema toxicum neonatrum, the fluid filled blisters, and even this one reddish spot, small spots, flea bitten like appearance we see. Again, this is the same thing, right? So yeah, don't confuse it. It is a normal newborn findings where most mothers get confused in OPDs, right? Erythema toxicum neonatrum. That's it. Now going with the second part. The second one is transient neonatal pustular melanosis. So what it is? It is a benign pustular condition present at birth. Tiny pustules without redness burst easily, leaving dark pigmented spots like scales. So it is present at birth, right? Commonly seen in forehead, chin, neck, back and buttocks. They are pigmented spots and they may persist for weeks to months. Usually no treatment is required, right? So these are the spots, right? Transient neonatal pustular melanosis. On these spots you can see white spots. These spots. Most of the lenses look similar with that of the first one that we learned. That is erythema toxicum neonatrum and transient neonatal pustular melanosis. Both ones look like same, but they are not. So going over to the third one, that is Epstein pearls. So what is Epstein pearls? The tiny white cyst on the plate and palate that we see due to trapped epithelial tissue. Small pearly white lesions they appear, seen on the roof of the mouth, right? So completely asymptomatic, no treatment is needed, disappears spontaneously within weeks. So conservative management, that's we counsel for the mother. These are Epstein pearls seen on the upper soft palate, or we can see on the palate part. These are the soft palate. So Epstein pearls. This is the Epstein pearl, right? Classically. Okay. Now going with the another part, that is milia. So what is milia? Milia, tiny keratin filled cyst due to the immature sebaceous glands, right? So they appear white or yellow or pinpoint most of the times, papules mostly seen on nose, cheek and the chin. Treatment, again no treatment, no squeezing or creams are needed, resolve spontaneously within weeks. So these are tiny pustular swellings, right, seen on the forehead, chin and then cheeks. No treatment, as conservative. Most of the times mothers are confused, right, what we need to do, or we need to change something, or we need to give some powder locally. So no treatment is needed. Now going on with the next is the Mongolian spots. What are Mongolian spots? These are tiny bluish grey pigmented scaly patches by dermal melanocytes, right? They are mainly seen on the lower back and then buttocks. Common in Asian and then dark skinned babies. Can mimic bruises most of the times. Fade gradually during childhood, no treatment is required. So this bluish part is called as what? Mongolian spots. Mongolian spots. Again this big Mongolian spot, right? So now going on with the next one, that is neonatal teeth or neonatal teeth. So neonatal teeth is basically natal teeth is present at birth, whereas neonatal teeth present erupts in the first 30 days of life. Lower central incisors that we see most commonly in newborns. This problem it creates is that feeding difficulty, tongue ulcers, and aspiration. It gets broken down and baby swallows it. So usually management is usually observation, extraction only if loose or you feel like it might fall. So again, this is natal teeth. This is natal teeth. This is natal teeth, right? Again, this one is also natal teeth. So yeah, next going off with stroke bite. What is stroke bite? It's also called as salmon patch. So yeah, It is common vascular birthmark due to the dilated capillaries. Small capillaries get dilated, so it appears like a stalk bite. Mostly it's just flat pink or red patches, right? Mostly seen in the nape of the neck, similar to that of stalk bite. Eyelids, and then forehead angle kiss, that's what we call. Usually fade with age, except neck lesions usually persist most of the times. Nothing need to be done because again it's a normal newborn finding, right? So this is seen, that is stroke bite and forehead part. Again this is the stroke bite, and again this is a stroke bite. It's a normal newborn finding which persists after 1 week. Next normal newborn finding is peeling of skin, which is normal shedding of the superficial skin after birth. Most of the mothers complain that my baby having peeling skin. What we need to do? Nothing. Most of the time post-term babies and hands and feet, right? Most commonly we see. No redness, associated oiliness, it absolutely normal. Gentle moisturizer if severe dehydration or severe dryness is present. Otherwise, odd excessive soaps or any random soap, right? This is peeling of the skin that we see on the legs of this baby. Peeling of the skin seen on the leg again. Peeling of the skin on the stomach part, leg, on the forearm part, right? Then going with the next newborn finding, that is subconjunctival hemorrhage. What is subconjunctival hemorrhage? Bleeding from the subconjunctiva. Small bleeding under conjunctiva during birth pressure. Bright red patch seen in the white part of the eye. Otherwise, baby is normal. Resolve spontaneously within 1 to 2 weeks. Nothing need to be done. No treatment is required. Again, this part, subconjunctival hemorrhage. This part, subconjunctival hemorrhage. Again, this part, subconjunctival hemorrhage, right? So these are all normal newborn findings again. Again, we're going out further. There's cradle cap. What is cradle cap? Mild seborrheic dermatitis in infants. Yellow greasy scales seen on the scalp. Non-itchy usually is due to the maternal hormones and sebaceous activity as glands, right? So what we do over here, we gently shampooing, soft brushing, remove the soft part, coconut oil or mineral oil before washing, so that the area doesn't keep dry. Scales get accumulated, right? Resolves over months to weeks to months. No treatment is needed. Again, this is a cradle cap. Cradle cap. Again, this is a cradle cap, right? So this is normal newborn finding. Again, further going with the next newborn finding is breast engorgement. Most of the times, mother complains in the OPD saying newborn babies have breast engorged. So they try to put pressures and remove the abscess part or fluid part. Don't do that. Temporary breast swellings in newborns is due to the maternal hormones, right? Seen in both sexes, males and females, may secrete witch milk. That's what milk. Some part the fluid comes out, so they think it's milk, witch milk, so they try to remove it. Don't do that. Don't squeeze the breast. Resolve spontaneously within few weeks, right? So this swelling part, normal newborn finding. Again, this swelling, normal newborn finding. This is normal newborn finding, right? Don't try to do anything. It's absolutely normal, breast engorgement in newborn. Then going over with this is again normal newborn finding, breast engorgement. Vaginal bleeding or pseudo menstruation in OPD, mothers complain that my baby, newborn baby 7 days old is bleeding. Diaper is red after passing stool. The bleeding is from the vagina, not from the stool part, right? So what we need to do, is there any treatment for this? Absolutely no. Small vaginal bleeding in newborns and girls is due to the maternal estrogen, maternal hormones are present, right, in the first 7 days of life of baby. So it's absolutely normal until the maternal hormones get out from the body, usually in the first week of life, right? Minimal spotting is seen, only red spots we see on the diaper. No treatment is needed, absolutely normal. Mother complains with this red part in diaper is bleeding from the diaper, from the vagina. Again the bleeding from the diaper, from the vagina. Again bleeding from the vagina, staining the diaper. Is it normal or not normal? See, one image they have put is that I got scared when I saw blood in my baby girl's diaper. So is it normal or normal? Apart from this, one important thing is that before commenting on it as a normal, always try to rule out any injury or local site by examining, right? If there is no injury, then it's absolutely normal newborn finding. Yes guys, the next normal newborn finding is physiological phimosis. So what is phimosis? Normal non-retractable foreskin in normal newborns, right, boys specifically. So foreskin naturally separates over years. It takes time, right, normally 5 years. So do not forcefully retract the foreskin. Gentle cleaning only. And pain, ballooning or infection or scarring, if anything is present, we need to consult the doctor. So what is normal? Foreskin can be pulled back over the glands, right? If it is not normal. If it is abnormal, then foreskin cannot be pulled back. So physiological phimosis is present till 5 years of age, present in almost all newborn boys, right? So it is normal till 5 years of age, so you do not need to worry. So this is normal. If you can pull back the foreskin from the glands, it's normal. If you cannot pull back, then it is phimosis. If you have pulled back, but you cannot retract back into the normal, so it is paraphimosis, just a constriction, right? So you need to know what is normal and abnormal to consult a doctor. Next, normal newborn findings is divarication of recti, diastasis recti. It is separation between the rectus abdominis muscle, right? Midline bulge when the baby cries. So why does it happen? Because the weak abdominal muscles, right? Treatment not required improves as the muscle strengthens and the baby grows and gains weight. So it is a midline bulge that we see between two rectus abdominis muscles, right? Again, this is midline bulge. Midline bulge, we see like herniation, which is absolutely normal. And the next one is sacral dimple. Is it normal, abnormal? Sacral dimple means small dimple present behind your buttocks, near buttock crease. We classify it as less than 5 mm, it is small. Midline present should be present in the midline. It should be close to the anus. And base should be visible, right? So red flag signs are if it is large or hair tuft are visible. Large and deep dimple of more than 5 mm associated with swelling or discharge from the dimple, right? This may suggest the spinal abnormality. So in such condition, we need to do sonography, local sonography, and see any underlying problem. So this dimple we can see over near buttock part, this dimple with hair, some part of hair we can also see over here, and again this dimple with some hair over here. So it is sacral dimple. And the next one is acrocyanosis. It's normal or abnormal. Cyanosis in our peripheral part. Bluish discoloration of the hands and face due to the immature circulation immediately after birth due to the cold exposure, right? Central tongue and lips remain pink, but your lower limbs, otherwise the baby is active. Improves with warming and circulation adaptation. Danger signs are only seen when there is central cyanosis or we need to evaluate the further, right? So you can see over central, this part, the cyanose as compared to the upper part. So yeah, it is acrocyanosis. Again, the palm area we can see cyanosed. Again, this part, the palm part, we can see cyanose as compared to the upper limb. So it is acrocyanosis, right? It's a normal newborn finding. This we need to monitor the saturation, know whether it's actual cyanosis present or not, right? Otherwise, conservative management is something we need to focus on. So yeah, this is what all about normal newborn findings, right? Follow more.